Welcome to Pharmacology case studies. We are going to start the topic of antipsychotics. Now, first one. An adolescent male is newly diagnosed with schizophrenia. Which antipsychotic agent may have the best chance to improve his apathy and blunted effect? Chlorpromazine, fluphenazine, haloperidol, risperidone. Option risperidone. Now, risperidone is the only antipsychotic that has some reported benefit in improving the negative symptoms of schizophrenia. The rest of the agents have the potential to diminish hallucinations and delusional effects, which are positive symptoms. Next, which of the following antipsychotic is a partial agonist at T2 receptor? Brexpiprazole, clozapine, haloperidol, risperidone. Option A, brexpiprazole. Now, this is the only agent which is listed as a partial agonist at T2 receptors. The drug will enhance the action at these receptors under low dopamine conditions also, and it will block activation when dopamine levels are high. All the rest of the drugs are antagonists at T2 receptors. A 21-year-old man has recently begun pimozide therapy for Tourette disorder. He has been having different appearing tics, such as prolonged contraction of the facial muscles, and he experiences opisthotonus, that is EPS, extrapyramidal spasm of the body, in which the head and heels are bent backward and the body is bowed forward. Which of the following drugs would be beneficial in reducing these symptoms? Benztropine, bromocriptine, chlorpromazine, risperidone. Benztropine. Now, the patient experiencing EPS is due to pimozide, and a muscarinic antagonist such as benztropine would be effective in reducing the symptoms. The other drugs will have no effect. In the case of chlorpromazine, risperidone, the adverse effects will increase. A 28-year-old woman with schizoaffective disorder, which is a combination of mood and psychotic symptoms, reports difficulty falling asleep. Which of the following would be most beneficial in this patient? Olanzapine, haloperidol, paliperidone, ziprasidone. Option C, paliperidone. Now, this is the only agent which is approved for schizoaffective disorder. Olanzapine has significant sedative activity as well as antipsychotic properties, and is the drug most likely to alleviate this patient's report of insomnia. Other antipsychotic may benefit this patient's disorder. Paliperidone has the indication for this disorder. And if underlying disorder is improved, then the symptom of insomnia may also improve without risking the other unwanted adverse effects of olanzapine. Which of the following antipsychotic agent is considered to be most potent and thus have the highest risk of EPS? Thioridazine, haloperidol, quetiapine, chlorpromazine. Option B, haloperidol. Now, among the older conventional or typical antipsychotics, haloperidol is the most potent and would thus be expected to have higher incidence of EPS. The atypical antipsychotics listed, quetiapine, could be considered low potency based on their common dosing and are considered to have lower risk for EPS. Now, which antipsychotic has most sedative potential and is sometimes questionably used as a hypnotic agent in certain clinical settings? Fluphenazine, thiazide, quetiapine, and haloperidol. Option C, quetiapine. Now, has strong antihistaminic effect, which will cause sedation and is also sometimes used as sedative hypnotic at low doses. A 30-year-old male patient is treated with haloperidol for schizophrenia. His psychotic symptoms are well managed with haloperidol. However, he is reporting restlessness and the inability to sit still at the dinner table, and his family notices frequently paces the hallway. Which is the best agent to treat this antipsychotic induced akathisia? Benztropine, dantrolene, bromocriptine, propranolol. Option D, propranolol. Now, propranolol is a beta blocker and is considered drug of choice for management of antipsychotic induced akathisia. Benztropine is more effective for pseudoparkinsonism and acute dystonias. Bromocriptine is more effective for Parkinson-like symptoms, and dantrolene is a muscle relaxant which is best reserved for managing some symptoms of neuroleptic malignant syndrome. Which antipsychotic agent is available in a long-acting formulation that may be useful for patient with difficulty adhering to therapy? Acinapine, chlorpromazine, clozapine, aripiprazole. D, aripiprazole. Now this is available in two different long-acting formulations. The other do not have any long-acting formulations. Which antipsychotic agent is most associated with the possibility of hematological dyscrasia, such as agranulocytosis, in a patient being treated for schizophrenia? Chlorpromazine, buspirone, lithium, clozapine. Option D, clozapine. Now, clozapine is the only antipsychotic medication that has a black box warning and a risk of agranulocytosis, and it requires regular monitoring. Which antipsychotic agent has been most associated with significant QT interval prolongation and should be used with caution in patients with pre-existing arrhythmias or patient taking drugs with QT prolongation? Thioridazine, risperidone, acinapine, and lurasidone. Option A, thioridazine. It has the highest risk for causing QT interval prolongation. Although this is general warning for many antipsychotics, thioridazine has been issued a black box warning with greatest risk for QT prolongation.